Roger Wells and proud to be the recipient of the National Rural Health Association 2018 President's Award. Thank you, Tommy Barnhart, for selecting me for this award. I've been a physician assistant at the Howard County Medical Center for 30 years. Howard County Medical Center is located in St. Paul, Nebraska, in the middle of the United States, where we provide services to a rural health clinic and a critical access hospital. My experience and exposure to the National Rural Health Policy was first being selected to the National Advisory Commission for Rural Health and Human Services, where we took time to travel throughout the United States and select areas of interest on policy and recruitment, retention, and other rural health issues, and make reports to the Secretary of Health on recommendations to assist rural health populations. Then I was lucky enough to be selected to the Congress of the National Rural Health Association, then eventually as clinical chair and to the Board of Trustees. Now I'm able to serve at the Center for Medicare and Medicaid Services as a clinical champion. There we comment on macro policy and unforeseen consequences in rural health care, as well as serve as a technical expert panel member on readmission policy and macro formations. Finally, I've been able to participate at the Office of the National Coordinator, speaking on policy and big data and how it affects rural health care and how it leaves us behind in certain instances when we don't have broadband access. I've also been able to speak at the clinical conference for CMS in 3 separate venues discussing how we've tried to put patients first and provide better care for patients in rural America. In the future, I see 3 big opportunities for the United States and how the rural health participants can be leaders. First of all, virtuality. No bricks, no mortar, no new staff, quicker responses. We are in an era where we're used to using apps. We use Netflix, Google, we use Amazon, and all types of platforms where we get instant gratification, instant service. In rural healthcare, we can be the leaders to develop this type of opportunity for our patients and show other Americans how this can be successfully used in a small and large venue. Collaboration. This is very important because we're not the only individuals in rural America. We need broadband for farming and fertilizer, for EMS, for public policy and disaster planning. If we collaborate with these other needs, we can be a bigger and louder voice with more success. Cooperation. We need to cooperate and be in the driver's seat of new policy and show other individuals what can be done and how it can be done, rather than wait for policy to be written and then go back and try to change it. We need to be in the front as the leader. So finally, we're not against the world, we are the world. And we can show others how we are the leaders in the United States, not the followers. We can make a difference. So step up, be virtual, be a collaborator, and be cooperative. But above all, be rural and be a leader.